Bismillah ar-Rahman ar-Rahim. Today we are going to talk about the remaining anti-adrenergic drugs or sympatholytic drugs. So we have discussed alpha blocker in the previous chapter lecture. Now we are going to talk about the beta blockers. So uh, beta blocker are classified as non-selective beta 1, beta 2 blockers like propranolol, nadolol, timolol, pendolol, labetalol, and carvedilol. These are non-selective blocker of both the beta 1 and beta 2. Beta 2 selective is butoxamine, which is clinically insignificant drug. Beta 1 selective drugs are betaxolol, esmolol, etanolol, metoprolol, acetylol, nebivolol, and partial agonist beta blocker with intrinsic sympathomimetic activity are pendolol and acetylol. Mechanism of action is beta 1 and beta 2 receptor are G stimulatory protein couple receptors, and this leads to activation of the uh, adenyl cyclase, and which leads to increased cyclic AMP and protein kinase enzyme. So when we block these receptors, it reverses the action. These are different receptors: alpha 1, alpha 2, beta 1, beta 2, beta 3, and D1, and these are the action which I have already discussed. Pharmacokinetic. So most of these drugs are they complete absorbed orally, but they have first pass effects, especially of the propranolol and metoprolol. So these have first pass effects, and about 70% of the drug is metabolized prehepatically. So it has a lower bioavailability, it is about 30%. Half-life of nadolol, which is the longest acting drug, which has a half-life of 18 hours, and esmolol is the shortest acting drug, which has a half-life of 10 minutes, and it is given IV, especially in arrhythmias and emergency cases. Pharmacological action of beta blockers. So CVS or cardiovascular system. So heart contain beta 1 receptors, and it decrease beta blocker decrease the heart rate, so it has a negative chronotropic effect. It decreases the force of contraction, so it is negative inotropics, and it decrease conduction velocity, so it is negative. Decrease cardiac output stroke volume, so it decreases blood pressure as well. Beta blockers are some of them are cardioprotective, have cardioprotective effects, and it prevents the remodeling after myocardial infarction, which is the cellular and intercellular changes which occur in the myocardium, and after that some uh, gross changes occur in the myocardium, and which leads to fibrosis. So beta blockers, like other uh, ACE inhibitors, it prevent remodeling. So it is used especially after myocardial infarction. Membrane stabilizing effects of beta blockers. Some beta blockers are membrane stabilizing effects as they block the sodium channel at high doses. So, like local anesthetic drug, it causes it stop depolarization of the membrane. Effects on the blood vessel, as the beta 2 receptors agonist or beta 2 stimulation cause vasodilatation in the peripheral tissue. But when we block these receptors, it block the vasodilatation. Initial, it increase in total peripheral resistance due to blocking vasodilatation, and also due to unopposed action of unfolded receptors. So there is slight increase in blood pressure. But after chronic use, vessels adopt to low cardiac output, and total peripheral resistance fall, and blood pressure decreases. It also decreases renal release from the juxtaglobulars cells of the kidney, where beta 1 receptor is present there. But in some cases, in some studies, it has been found that in some people, the beta blocker are used and there is no changes in the renal level, but they decreases blood pressure. So maybe there is some other mechanism as well. Bronchi or respiratory system. So beta 2 receptor present in the bronchioles, and when these receptors are blocked, it can cause like threatening bronchoconstriction, especially in prone patients like asthma and COPD. So use beta 1 selective receptor blocker or beta blocker with intrinsic sympathomimetic activity are given in the such cases like COPD or asthma. But if we give beta 1 selective receptor blocker on a very high dose, it can uh, lose its effect of beta selectivity, and it is also then contraindicated in asthma and COPD. So we should not prescribe high dose. In CNS, it causes disturbance in sleep, and it causes nightmares, forgetfulness, lethargy, and fatigue. Propranolol decrease anxiety in short-term stress situations like stage fright or stage anxiety, and it is used. Propranolol is used in such cases, and this effect is due to peripheral effects rather than central effect. Metabolic effect. So, beta blocker masks the signs symptoms of hypoglycemia, especially non-selective beta blockers. So, when the sign symptoms of hypoglycemia are palpitation, sweating, headache, and anxiety, these are the sign symptoms of hypoglycemia. So, when beta blockers are used, these sign symptoms have been masked by beta blockers. So it should be avoided in diabetic patient, especially in insulin-dependent diabetic patient who are prone to hypoglycemic episodes. Metabolic other disorders are decreased insulin release from the beta cell of the pancreas. So it causes it causes hyperlipidemia, especially increased triglyceride level, cholesterol, and VLDL are increased with the use of beta blocker, and high density lipoprotein are decreased with the use of beta blockers. Beta 1 selective and partial agonist do not cause these effects. So if we use beta 1 selective, we use intrinsic sympathomimetic drugs in such cases, so it has little or no effect on the lipid metabolism. Eyes, beta receptors and ciliary body. So when these are stimulated, it stimulates aqueous humor production, and it causes glaucoma. So by blocking beta receptors, by the use of beta blocker, it decreases aqueous humor production, and so it decreases fall in the intraocular pressure, and also decrease the severity of glaucoma. And in this situation, we should keep in mind that we should use the drugs which have no membrane stabilizing effect. Because if membrane stabilizing effect beta blockers are used in such situation, it will decrease the sensitivity of the cornea and will lead to corneal ulceration. Miscellaneous beta blocker inhibit adrenergic mediated tremors, impotence due to inhibition of vasodilatation, and membrane stabilizing effect, local anesthetic effect like propranolol, propranolol, acetaminophen, and metoprolol. So these should be avoided in eyes. Use drug without anesthetic effect like timolol. So timolol is the drug of choice in glaucoma. clinical uses. The most important use of the beta blocker is in the heart, where beta 1 receptor lies. So it decrease heart rate, decrease force of contraction, and decrease conduction velocity, decrease cardiac output, and decrease stroke volume. So it should be used especially in the ischemic heart disease or after MI. Decrease workload of the heart. Hypertension. Beta blocker reduce cardiac output, decrease blood pressure, and decrease renin release, so decrease blood volume and decrease blood pressure. Beta 1 selective are preferred. Atenolol, metoprolol, and others. Esmolol is fast acting and short of life, so it is used in hypertensive emergencies through intravenous route, and in that it is also used in supraventricular tachycardia or other arrhythmias. Angina, as it is a developers are negative anthropic, negative anthropic, so it decreases oxygen consumption in demand, and it is used in the angina to reduce workload. After MI, beta blockers prevent arrhythmias after cardiac infarction because it reduces automaticity of cardiac pacemaker and decrease the size of infarct by decreasing oxygen consumption. It prevents remodeling due to over release of the norepinephrine. Heart failure. Beta blocker decrease oxygen demand and decrease blood pressure, prevent remodeling, and it prevent arrhythmias. It decreases mortality. Drugs, most of the beta blockers are contraindicated in heart failure because it borderline heart, it increase the chances of full-fledged heart failure in patient with borderline heart failure because it slow the heart rate and it slow the contraction, so it leads to heart failure. But in chronic heart failure, we use carvedilol, labetalol, and these can be used because it increase the life expectancy of the patient. Supraventricular tachycardia. So beta blocker slow or block AV conduction velocity. It is dromotropic. So it block re-entry, arrhythmias, and propranolol, esmolol, and acebutolol of the drug supraventricular tachycardia. Esmolol is especially used in emergency cases. Hypertrophic cardiomyopathy. As beta blocker slow rate of cardiac contraction, so it is used in hypertrophic cardiomyopathy, and especially propranolol is the drug of choice. Thyroid storm. In thyrotoxicosis, it inhibit peripheral beta blocker inhibit peripheral conversion of T4 thyroxine to T3 or triiodothyronine, which is an active form. So beta blocker reduce cardiac rate and arrhythmias. Thyroid hormone sensitize the heart to the effects of catecholamine. So there are more chances of arrhythmias. So beta blocker reduce the sensitivity of the heart. It also reduces the tremors and tremors, which is in thyrotoxicosis, and the drugs which are used are propranolol, esmolol. Glaucoma. Beta blocker reduce secretion of aqueous humor. So the drug for eye should be lipid soluble for easy penetration, but without membrane stabilizing activity, like timolol. It is the glaucoma. These are different drugs which are used in glaucoma, like beta blockers, cholinomimetics, alpha agonist, alpha 2 agonist, prostaglandin, carbonic anhydrase inhibitor, osmotic agent, and alpha agonists. Migraine prophylaxis. So, although the mechanism is not clear, but propranolol has been used in migraine, especially for prevention, not in acute stage. Familial tremors and stage fright. For this purpose, propranolol is preferred. Toxicity of beta blockers. Cardiovascular toxicity are bradycardia, ventricular block and heart blocks and heart failure. It can cause exacerbate asthma, RCOPD, masking up hypoglycemic response in diabetic, especially in IDDM. Toxicity in CNS are sedation, fatigue, nightmares, and sleep alteration, sexual dysfunction. Non-selective beta 1, beta 2 blockers are these are the beta blockers which occupy both the receptors. These are pendolol, acetylol, propranolol, celiprolol, otoprolol, and alpranolol. Contraindications of beta blockers. The first one is the bronchial asthma and COPD, cardiac failure, heart block, and especially along with the calcium channel blocker. Peripheral vascular disease like Raynaud phenomena and other peripheral vascular disease, and these beta blockers are IDDM with hyperglycemic state. So beta blocker should not be used in such situations. Thank you.